Hello, everyone. Today we're going to be talking about diabetes. So, what is diabetes? It is high blood sugar. It's the basic thing, but it's high blood sugar that has been high for a long time because it's a chronic disease. In medicine, chronic means it's been occurring for a long time. So, long term high blood sugar. There are two basic types. It's really more than two types, but two basic types of diabetes. The first one is autoimmune. The body's immune cells basically attack the cells in the pancreas. The pancreas is the organ that produces insulin, basically attacks those organs. And so that person isn't producing any insulin or is producing very low amounts of insulin, which is not sufficient to take care of their blood sugar. So that's type 1. And then more commonly, and the focus of our conversation today, we have type 2 diabetes. In type 2 diabetes, people are producing insulin, but their body isn't using that insulin effectively. And so that leads to the blood sugar running high and running high for a long time. And I use the fence analogy. So it's not an exact process of what's going on, but it just kind of helps form a picture for you to understand what's going on in type 2 diabetes. So let's picture a yard. This yard has a fence around it. The fence should only be 2 feet tall. And then you have someone outside of the fence. Let's say it's me outside of the fence. Outside of the fence is the blood, and inside of the fence is the body cells. So I'm outside the fence. I put on the sugar, the glucose, like a backpack, hop over this 2 feet fence, and I take the sugar off inside there. That's what should happen. Now, let's say that instead of this fence being 2 feet, the fence has been raised now and it is 6 feet, 8 feet, 10, however high. There are different levels of insulin resistance. So the height of the fence is basically insulin resistance. Now I'm outside of the fence with the sugar on the backpack, and I can't get across because now the fence is too tall. You need 2, 3, 4, 5 of me standing one on top of each other for only one to make it across. This is what's happening. So you have a lot of insulin in the blood and you have a lot of glucose in the blood in type 2 diabetes. So what we're trying to do is get the height of the fence down, and we're also trying to reduce how much sugar is waiting to get across. We get the height of the fence down with physical activity, with exercise. And we're aiming for at least 30 minutes a day, 5 days a week. This should be moderate intensity exercise. Moderate intensity exercise means while you're doing it, you can talk to your friend if you're, exercising with your friend, but you can't think. So that's a rough guide to what moderate intensity exercise is. It looks like brisk walking. It looks like swimming, not very intense swimming, but it looks like swimming. It looks like dancing, things like that. Riding a stationary bike. So moderate intensity exercise, at least 30 minutes, at least 5 days a week. You should also add in some resistance exercise there, because the more you activate muscles, the more you're helping that insulin resistance, the more you're lowering the blood sugar. So add in some resistance twice a week. And resistance is you could be using your body weight or using actual weights, or crank up the intensity on your treadmill or your stationary bike, things like that. So resistance at least twice a week. The smart thing to do, especially if you don't have time, is just combine it all. So if you're going on a walk, you might wear a weighted vest. You might put the weights. You have these weights that you can wear on your wrists, on your ankles. So you can add resistance along with your aerobic exercise and just get the two of them done together, but you need both. So that's for physical activity. I will sound a note of caution. Please carry water with you. Have water nearby when you're exercising and stay hydrated. And keep a source of easy sugar. It could just be sugar, something to give you a quick supplement of sugar, of glucose while you're exercising, because your blood sugar as a diabetic can drop during exercise. So physical activity helps to decrease the height of that fence. It helps to bring down the insulin resistance. Then the other thing we want to do is take care of the diet. You want to reduce the amount of carbohydrate in your diet. Note that I'm not saying eliminate carbohydrates. Some people do, but in a lot of people, eliminating it altogether sometimes leads to swings because sometimes you get the carbohydrate, other times you don't. So long term, for most people, it is better to just lower the amount of your carbohydrates. We're usually saying aim for 45 grams of carbohydrate in a meal and 15 grams in a snack. I'm going to put a link in the comment section with what a serving of carbohydrate is. A serving is 15 grams of carbohydrate and what that looks like for different foods. So examples are 1 slice of bread, or half a cup of cooked cereal like oats, or a third a cup of cooked rice. It's 1 small fresh fruit like an apple, 1 cup of milk. So you can see that with breakfast, if you have a slice of toast with maybe some eggs, and you have an apple, and you put a cup of milk in your coffee or tea, that basically is 45 grams of carbohydrates. So building your meals to be lower carbohydrates. You want the carbohydrate to be whole grains. Anything that's quick, your glucose spikes and then drops. Whole grains are better for you because of the fiber, and it just releases the carbohydrates slower. It's better for your gut health and all of that. So we're aiming for whole grain carbohydrates. You're aiming for non-starchy vegetables. So the American Diabetes Association recommends a 9-inch plate. Half of the plate is non-starchy vegetables, and I'm also going to link examples of non-starchy vegetables in the comment section. So half the plate non-starchy vegetables, one quarter of the plate your whole grains, and then the other quarter of the plate lean proteins. And I'll also link examples of lean proteins in the comment section. So we're aiming for lower carbohydrates, whole grains, so that you get the fiber and you're avoiding processed foods. You want to have lean protein as you build your plate, plan out your diet. Aim for water. Don't drink your calories. Don't drink extra sugar. Just aim for water as your source of hydration. So that's the basic information on the diet. Then we proceed to monitoring. So we monitor at home with finger sticks. I have my patients check finger sticks in the morning, fasting, and in the evening before dinner. So before food, we're looking for your glucose to be between 80 and 130 milligrams per deciliter. With other measurements, it's 4.4 to 7.2 millimoles per liter. And this is before food. After food, we want it to be less than 180 milligrams per deciliter. That is 10 millimoles per liter. And so if your numbers are staying in this range, it's a good chance that when we check the A1C, your diabetes will be controlled. Now, a lot of people are also using the continuous glucose monitor, which makes monitoring much easier. And so we want your glucose to be in range between 70 and 180 more than 70% of the day, if it is with the continuous glucose monitor. So that's what we're doing for monitoring at home. Now check with your doctor what the best number for you is. Because as people get older, if you're more frail, we relax those numbers. And then for some people, like pregnant women, those numbers are tighter. The control needs to be tighter. So please check with your doctor. But the numbers I gave are general for most people. Those are the numbers we aim for. So that's the monitoring you're doing at home. We're also checking the A1C every 3 months. Sometimes we're doing that more frequently, especially if diabetes is very, very uncontrolled. Sometimes we're checking it more than every 3 months, but on average, A1C every 3 months. We're also making sure we're monitoring for complications of diabetes. So at least once a year, you should be having blood tests to monitor your kidneys. We do your foot exam in clinic. You do an eye exam. All of those things to monitor for the complications of diabetes. At home, you should check your feet every day, clean your feet, inspect your feet every day. Other things are your dental hygiene. You're very high risk for infections if you're diabetic, so you want to make sure you stay on top of dental hygiene, both on your own and with your regular follow-ups with your dentist. You want to manage stress. You want to sleep well. high stress, poor sleep, or raised blood sugar. We have vaccines when you're diabetic. So we have all the routine vaccines, but especially the pneumonia vaccine. So you may not need the pneumonia vaccine based on age, but if you're a diabetic, you may need the pneumonia vaccine. You need to be up to date on hepatitis B vaccine and things like that. So again, talk with your doctor. We usually would start cholesterol medicine in a diabetic, not necessarily because your cholesterol is high, but because your cardiovascular risk, the risk that you might have a heart attack or stroke, is significantly elevated if you're a diabetic. So again, that's something to talk to your doctor about. So in summary, if we are pursuing regular physical activity, at least 30 minutes, at least 5 days a week, moderate intensity, add in some resistance there. Follow a lower carbohydrate, high fiber diet with lean protein, and undergo appropriate monitoring, both the monitoring you do on your own with checking your glucose, with your food exams every day at home, and then following up with your doctor for the monitoring that your doctor will do in the clinic. If we put all of these things together, you can live a good quality life with diabetes. I will see you next week. We will talk about chronic kidney disease next week. Take care.